This is where doctors and nurses take care of babies born ill or premature. Salinas Valley Memorial's Neonatal Intensive Care Unit. Welcome to the Neonatal Intensive Care Unit of Salinas Valley Memorial Healthcare System. I'm Dr. Bob Morali, and for the next 30 minutes, we'll go inside the world of neonatal intensive care, where specialists work daily to save the lives of ill and premature infants. A neonatal intensive care unit like this one is referred to as an NICU or NICU, and it's here where medical wonders happen every day.
The NICU is really it truly is a specialty care area. It's involving equipment and individuals, highly specialized, who are going to take care of babies. It's a totally different field than other areas of medicine. And so it's very meticulous in terms of making sure we provide accuracy in all these tiny things that we have to do for our tiny patients.
This is not just adult medicine on a smaller scale. This is really a totally specialized field.
Absolutely, totally different. As you can see, as you look around the room, it's a quiet place. It's relatively subdued. There's kind of a quiet feeling of everything's under control. It's reassuring to babies and to families. We also have these curtains on each of the care areas, and so families, if they want to visit, they want to have total privacy. If a mom wants to breastfeed, she has total privacy. They can just shut the curtains off. They have their own little special NICU unit that's all their own, yet babies continue on monitoring. We can flip that monitoring over to another monitor if we can't see it because of the curtain, if we need to see it. So there's lots of ways we can continue to be involved in babies' care and yet not be invasive in terms of the family's privacy and special time together. One thing I observed, this is very family friendly. I mean, I see the families coming in with the infant, and they seem they have a lot of confidence in what's going on here, and they also seem to feel real able to participate in the care of the patient. And that's one of the things we let them know right away as they come in, is that there's no visiting hours. We're open around the clock. They can come in any time of the day or night. But parents have total access to their baby around the clock. Very calming in here too. Yeah. I mean, it's not the high stress level that you would used to see in an intensive care unit. People are very calm and relaxed, and the nursing care, I'm impressed with how they interact with the family too, especially. Yeah, very supportive care.
By having neonatologists on staff, having the pediatricians and the nursing staff and the respiratory therapists all currently being kept up to date by the training that they provide here on site, we're essentially at this time providing the highest level of care that children need.
And these gentlemen here specialize in nothing but newborns, and especially in the baby under 5 pounds and 4.5 pounds, where they really need the special care. And so that's been a tremendous advance in the medical care in our community, which I think is extremely important.
An important part of that supportive care is a practice of developmental medicine or developmental care.
Developmental care is the type of care that we give that isn't just medical care. It comes from the heart. It comes from knowing what the baby needs to help them be stress-free. It doesn't mean just making sure that IVs are in and the baby is eating. It means, is the baby comfortable? Are we keeping the baby secure? Are we respecting what that infant is telling us? It's a different way of thinking about giving medical care than if we're just looking at making the numbers look right and giving a medication at a certain time. So it's really a change in the way that we think about giving care.
This is a bunting, bedding bunting that we use for the babies, and it's to help make them feel enclosed as if they were still in mom and not expending their energy, moving their arms and legs about, and they feel very calm and comforted. And we put them in these buntings or wrap them and swaddle them so that they feel like they can be safe, a safe environment where they can grow. We try to keep the lights down to a minimum, the noises down to a minimum, so that they do spend their energy just growing.
All of this helps babies grow and helps families cope.
Many parents will be nervous about touching their infant. Can they touch them with the different lines or an IV or a heart monitor? And it's so wonderful to be able to show them, look, your baby hears you, they recognize your voice. They're opening their eyes to your voice, not mine. When you put your finger in their hand, look how they hold you. And many times you'll just see both parents break into big smiles when they know they've made that connection.
First time I ever went to a delivery and was taking care of a baby when I was first a new nurse, and the dad walked over and just said one word and the baby just looked right at him in his eyes. I knew right then, that's bonding.
An important part of that bonding comes when mothers breastfeed their babies. Part of the Salinas Valley Memorial neonatal team includes a breastfeeding specialist.
They will get this support and care throughout their stay here, and encouragement to come in and be with their baby and to breastfeed, and not to be scared of it, because it's a scary thing when you have a small child and a baby that's born prematurely, a lot of lines, a lot of different things going on. So if you can focus them that they can do something for the baby even though they can't touch the baby yet, or be right with the baby for every time like you would when you went home with a normal newborn, that this would encourage them to keep coming in and being involved with their baby while they're in the NICU.
Babies that are born without the stress of an intensive care nursery handle being touched and moved about in different ways. For them, comforting many times means rocking, jiggling, patting, and holding. Our littlest, sickest infants cannot handle that type of movement. For them, consoling maybe means just hands quietly touching them, maybe even just one hand at the top of their head, holding it. Sometimes just a parent's finger or a nurse's finger in their hand will give them a little bit of touch to give them the consolation that they need. Too much movement, too much stimulation from outside will only make them more stressed.
The stress of a premature infant is nothing new to the Richardson family of Toro Park. Teresa and Kevin Richardson's life together had a storybook beginning. Both Stanford athletes, they married and settled down to start a family. But when Teresa was almost 6 months pregnant with their second child, there was trouble.
We absolutely were terrified. Right, well, I woke up one morning and started hemorrhaging, and made it to Salinas Valley.
The decision was made then by Dr. Watkins and his group that we're going to stay in this bed and we're going to try to continue this pregnancy as much as we can.
But after 2 weeks, Teresa went into labor. Doctors made the decision to fly her to UCSF to deliver.
And that was really scary because I just felt like I was in a nightmare. Because I had, for 2 weeks straight, I had been telling myself, I'm going to hold on to this baby, and everything's going to be fine. And so suddenly I'm in this position where it's like, I really could probably maybe deliver on the helicopter, and that would really not be a good thing, The
intention was, when we arrived at UCSF, to continue the pregnancy. Then once it was determined that that was not a possibility, that's when they basically go into crisis mode and say, okay, this is what we're going to do.
Teresa gave birth to 2-pound, 4-ounce Carl Francis Richardson. It was a very difficult beginning and meant 9 weeks of commuting to San Francisco to see their baby, who was clinging to life.
The odds were gravely against us, I guess, to say.
Well, it was really scary. And, we didn't know if he was going to be with us. I felt like I was making progress towards the end of his stay at UCSF because, I only, bawled about to San Jose, and then from San Jose on, I was okay, But it was, it was a lot of tears, absolutely.
Finally, doctors transferred Carl to Salinas Valley Memorial's neonatal intensive care unit.
And that was just a huge blessing for us because we weren't commuting up there, and it was so nice for me to be able to go see him every day, and under the care of Dr. Castine, and the nurses there were just great. So it was a wonderful 2 weeks for us.
Carl is now a happy and healthy 2-year-old boy, often playing with his older brother Jack.
You can look at it one of two ways, I guess. You can say we were incredibly unlucky, but looking at what's going on now, I guess we're probably the luckiest people around, I think.
Yeah, it's definitely hard to recount the story and it does not bring, it always brings tears to our eyes. Yeah. I mean, we consider ourselves very blessed.
You want to play with the train? Come on, yay!
The Richardson's baby had to go to UCSF because that facility has what's known as a Level 3 NICU. Now, Level 3s handle very premature and ill infants, those weighing as little as 2 pounds. Currently, Salinas Valley Memorial has a Level 2 NICU, but plans are underway to open a Level 3 very soon.
Well, I'm very excited about the concept of going to Level 3. A Level 3 nursery basically is one that allows you to keep a baby, sicker babies, smaller babies. And that's where neonatology starts to become, in very many ways, more complicated, more stressful, but it's also more rewarding.
We have a full team. We have 2 neonatologists, full team of nursing right now for our Level 2, and our respiratory therapists and occupational therapists, social workers, case managers, just a wonderful group of people and ready for the new challenge in NICU 3.
A Level 3 nursery has been a long-time vision of the Board of Directors and President CEO Sam Downing.
Well, it will mean the strongest program you can have in the region, where you would not have to be transferred to Stanford unless it was very, very unusual. But it brings us that much closer to a program where you can feel very comfortable that you can have everything done at one location.
Sam, why was it so important to you to bring a neonatal intensive care unit to Salinas Valley Memorial?
Well, it came at the right time because our focus was on young children, families, and the whole family concept has been here for years, and we've tried to take it in stages. And we did the pediatric center. It's the only pediatric center in the whole region. And then we kind of beefed up our emergency room where they could treat young kids, and we had the right medical staff for that. And then we did the single room birthing, which was 23 beds, and the first in the region. And then it just seemed logical that we should go for a Level 2 nursery, which, gosh, would bring a connection with Stanford. They could kind of work with our physicians, and we could really focus on a really strong program where all of us would feel comfortable bringing our own children.
What is it about this neonatal intensive care unit that makes it so special?
It starts with the staff. The physical space is great. And the equipment, because of Children's Miracle Network, we've been able to raise millions of dollars for the hospital for children's services and maintain the hospital still in a debt-free position. And there's a lot of money has been provided for families that could not even afford care.
You've always made a commitment to the latest and greatest technology. Why is that so important?
Everybody expects you to be on the leading edge of technology, because if you're not, then you're just a nice community hospital that might be in a rural area. And particularly the ag community is very high in research, because they're not subsidized at all. And so they have to be very efficient, and they just take it as, no, it's not a big deal. You should be there. They expect it. They're billion-dollar companies that still have their home roots right here in the Salinas Valley, and they consider this their hospital. And when their mother or father, or family members need to come here, they want the best, and they're willing to help make that come true.
We're going to want to look at that left pulmonary artery a little more closely as well.
Inside the neonatal intensive care unit at Salinas Valley Memorial, doctors use technology that they could only dream of a few short years ago. Here, where the tiniest, most fragile babies are nurtured toward wellness, physicians are able to call on the expertise of Stanford specialists when they suspect a heart defect in a baby.
So this baby is an infant we brought over to the NICU. It's a 2-day-old baby. The attending physician heard a murmur,
And when we got the baby over here, we noted the color wasn't so great.
It's already obvious that there's a congenital heart problem here, David.
Through high-speed audio and video link, Neonatal Intensive Care Unit Medical Director Dr. David Castine is able to consult with Stanford pediatric cardiologist Dr. Dan Murphy as an echocardiogram is performed on a premature infant. Dr. Murphy is not only able to see the results of the test immediately, he is also able to direct the technician as the test is being taken.
We now have a tele-access, what's called a tele-echo, and we can actually do an echo and have a cardiologist on video standby watching the echo as it's being done, read the echo and tell us exactly what the status of the baby's heart is and what the diagnosis is. And if the baby then can stay at our facility or needs to be transferred on to a higher level for further care.
It seems also the convenience for the family to be able to stay at home and just go a short distance to be with their child.
Tremendous. And as the baby gets better, that becomes even more critical because our goal, of course, is to get that baby successfully home. The more time the families can spend together, the mom can establish breastfeeding, for example. That's going to be a lot easier because baby's right here next to home. It's going to be much greater access for mom to get back and forth to the hospital, spend more time with the baby. And studies have shown that babies who have that kind of access have a speedier recovery and a quicker process of being discharged back home.
The collaboration builds close bonds that work to the benefit of other kids in other settings as well.
Well, it's really nice for us knowing that we can have you take a look at a study as we're doing it. We have an immediate answer, like you said.
It's not just the echo information. You can send me a tape or send me digital pictures. That's not the same as this collaboration between the docs. I get the history, I get a better picture of the baby that we're looking at as far as their echo goes. I got a better clinical picture. The same goes, the questions I answer for you are the ones you really want to know.
The Salinas Valley Memorial link with Stanford goes way beyond this telecommunication technology. The two neonatologists on the Salinas Valley Memorial medical staff are both on the faculty of Stanford University, but live and practice here, making Salinas Valley Memorial the only facility in our region with round-the-clock access to neonatal care. This is another of the most recent high-tech additions to the Salinas Valley Memorial NICU. It's a tablet PC and it's changed the way doctors practice here. This, along with Stentor software, allows doctors to access patients' test results anywhere and then bring those test results right to the patient's bedside.
Basically, the Stentor system allows us to view a digital copy of a baby's x-ray. And so on this tablet PC, which I chart on and actually do my medical record, I can also go into the Stentor system right from the note, pull up the baby's x-ray, review it, and then go back to my note and continue my medical charting. The other advantage with it is I can take the tablet off of the PC portal base and go out to the mom's room. Anywhere I go in the hospital, I can pull up this film. So I can review the x-ray with mom, show her what the x-ray looks like, point out any particular things that I'm concerned about and review it with her.
People are more educated today than they were in the past in terms of their health care. They want to be more involved in their health care. This is a perfect tool to sit there and being able to show exactly what the problem is, where it is, and possibly the surgical plan to address the situation. It's huge when it comes to patient education.
I can also, if I'm, for example, at a departmental meeting or a conference that I need to attend, but there's an x-ray I need to look at, I don't necessarily need to go back up to the unit. At that conference, I can pull up the film, review it, and say, oh yes, it looks fine, or oh, I need to go back up and do some things. I'm going to have to leave the conference.
Dr. Castings can be in another part of the hospital altogether. There's a concern with one of the nurses that maybe a line's not placed correctly. She can page him, he can call up, as opposed to going back up to the neonatal intensive care. He's actually able to bring that image up on his notebook and make the call from anywhere within the facility.
This image is dynamic, and then I can change its quality by moving my marker pen around. So an area of the film that I need to look at a little bit better, I can actually magnify that area. I can go off and take a look at that area specifically. or I can, like I did earlier, take the entire film and change the brightness and the contrast in the x-ray and highlight and improve the quality of the film, so I don't have to re-x-ray the baby.
With this technology now, we're able to actually give the ability to the physician to consult with one of his colleagues, say like at Duke, at UCLA, at Stanford, instantaneously, not having to wait 24 or 48 hours to get this information so that the child can be treated immediately. There's a quicker turnaround time. Everyone benefits from this.
It's a great tool. I use it all the time. And está bien. All of the areas look good. Everything looks fine.
It takes a special person to work in a NICU. Every day is unique and often unpredictable.
What we look for in a NICU nurse is somebody who's very detailed, who pays a lot of attention to sort of micromanagement of the babies, and obviously to the incredibly small size of the baby, someone who's very comfortable with such a fragile human being, such a fragile creature as a baby that might even weigh as little as a pound.
It's a very exciting unit. There's always something new going on. Your days are never the same here. It can be exciting and scary. Your day's always going to be different.
On this day, neonatologist Dr. Greg Glasscock will meet with a woman who very early in her pregnancy is in trouble.
My job now is to go and talk with her and let her know what she may be in for in terms of the kind of difficulties that are associated with premature babies of 25 weeks gestation.
And it looks like she is stable. She's feeling them less. She was pretty uncomfortable earlier, but she's more comfortable right now. She should be going as scheduled.
Yeah, okay, good. I came over because I wanted to let Mom know about the possibilities of what it might be like if she delivered early. So I was just going to go in and visit with her. I'm here because I need to let you know the what ifs. What if things don't go as planned, as we're hoping, and actually you go into labor and you have to deliver your baby soon. So your baby's about 15 weeks early, and that's really quite early. I really think it's important that we share what we know so we don't go into this blindly. So if a baby was born now, it wouldn't be like a cakewalk. It would be more like a roller coaster ride. I'm sorry, this is really scary.
Yeah.
And that just means you really love your little baby and you want things to go well. And I think you're in really good hands, and I think that we're going to do a good job with your baby.
Yeah, that's what I think too. That's what I'm thinking, and I'm going to think positive, and I'm in good hands, I know.
Well, we're happy to report that Mrs. Cervantes' contractions stopped and she is now waiting her full-term delivery. One of the most innovative programs at Salinas Valley Memorial's NICU is infant massage. 2 certified infant massage instructors are part of an extensive NICU team here, helping parents of premature infants learn how to touch and communicate with their babies.
Give her some support and do some small circles on the top of the foot.
The massage techniques primarily promote communication with parents and infants. So the technique itself is not so much what you think of a massage to relax, soothe muscles, as it is for the parent to be able to start earliest communication with their infant. Through their hands, the parents are learning how to touch their baby, respect their baby, and learn the language of their infant. Their infant has a lot of different ways to tell them they're handling it. You're close. I know it. I can feel you. I sense you. And by opening up the parent's eyes to the infant's communication, we help them both handle the stress here in the NICU better as well.
And by learning the communication, she looks at you, she tells you things. It's her language.
Anytime we begin a massage on an infant, what we teach a parent, I'll be holding my doll and the parent will be holding their own baby. So I will teach on the doll while the parent does self-discovery with their own infant. And the respectful part is just that early touch. Baby, are you ready? Can I go ahead and touch you now? It's asking their permission. It's getting them ready. It's me watching the baby for any little language or signs that stressed infant may tell me, no, not right now, or no, I'm not ready. And my honoring that will tell the infant that I'm really listening, I'm hearing them, I'm not going farther. If the baby is nice and happy and flexed up and cuddly cozy and seems to be handling just that early touch on their head or on their hand, then I'll go ahead and teach the parent how to proceed with more massage technique. But it's always a dance between the person touching and the infant who's giving feedback how they handled it.
And then we're going to go on and do the squeeze and twist. How's she doing there?
The really interesting thing is that babies can talk to us regardless of the language that's spoken at home. A baby has a universal language for telling stress signs, for telling us when they're happy, for telling us when they're contented, or surprised, or angry. And we've learned that language by looking at their facial features, by watching a change of breathing, by watching their hands or arms. Are they out telling us stop? Are they flexed and happy next to their face? If you know the language, the whole communication with that infant is unlocked and more bonding can take place. The infant starts learning such a sense of empowerment that someone is really listening to them and getting it right. And that's what the massage technique, that's what developmental care tries to do. Get it right for these infants.
Her hands are opening to say stop.
One baby at a time, helping foster a sense of security and respect between the caregiver, the parents, and that infant that will last a lifetime.
It truly is a place of medical wonders. And with a level 3 nursery in Salinas Valley Memorial's very near future, the outlook for the region's tiniest babies has never been brighter. We're very close to a time when babies born here will be able to stay here. Thanks for joining us. I'm Dr. Bob Morali.